Jose. I'm from Puerto Rico. My family is very traditional, and I come to treatment for my depression. Hello.
Hello, Jose. So I'm reading in your report that you have been feeling down in the dumps, and we would call this depression. Do you have any idea why you might be feeling this way?
Well, I think I finally come to the internal realization that I am in fact gay. And because of this, I'm feeling a lot of internal stress and anxiety, which is, I think, causing my sadness. And I think this is coming from the fact that my family is very traditional, and I'm worried that they won't accept me the same.
Okay. And why does that, what specifically about your family makes you worried?
Well, they are, as you know, we do come from Puerto Rico, so they're very Catholic and very traditional, and I'm just really worried that they, I'm their only son, so I'm worried that they might not be happy with how I've turned out because of their religious beliefs.
Are you ready to talk to anyone about your feelings, maybe?
I think I am. I don't think I want to tell my family first. I want to get my feelings off my chest to somebody I know will accept me a little bit better. So I don't think I'm ready to tell my family, but I want to tell somebody, but I don't know who.
That's completely normal and fine. Who would you say you're most comfortable with right now in your life?
You know, looking at everybody in my life, I think I've got to say I'm most comfortable with my best friend, Cassandra. She's really been there for me for a while, and I think she's the person I trust the most to accept me as who I am.
Okay, this is a really big step forward, and with talking to Cassandra, how would you feel most comfortable talking to her?
I think if I don't want to make too big of a deal out of it, so I think I just want to somehow bring it up in a somewhat serious in-person conversation. I think telling her face-to-face will really help me get it off my chest, and I know that I'll feel better after I talk to her.
That sounds like a really good plan. When you're talking to her, just remember, be confident, and just telling her what you really feel is really like what's going to help you out here.
All right, thank you. So I have good news. Last week I talked to my best friend, Cassandra. I told her about my sexuality, and she said that she was very proud of me for coming out. She knows how big of a step that is, and she said she was ready to help me with anything that I might need. And I think because of this, I'm ready to talk to my mother about it. Hi, Mom. I have to talk to you about something.
Hi, honey. What's it about?
So I've been going to some therapy recently. It's been very helpful to me, and I've also been talking to some of my best and closest friends, and I'm finally ready to tell you that I'm gay.
Oh, that's wonderful, honey. I love you.
Oh, I love you too. Thank you.
Hi, I'm Mr. Lee. I just experienced a very stressful season of college acceptance. I didn't get into the university my parents wanted me to. I'm anxious as a result.
Hi, Mr. Lee. How are you doing today?
I'm doing good.
All right. So let's get started. So, what are you been feeling lately, and what is causing you to come in for therapy?
I've been experiencing symptoms of anxiety, especially after my family's interactions.
Okay, so you said specifically your family interaction. What about your family is causing you to feel these sort of things?
I applied for MIT, Harvard, and Yale.
Okay.
I was rejected from all three.
Oh, goodness.
My parents have not acted the same since they saw the denial letters.
Okay, you specifically said, your family was not happy with you getting rejected from these colleges. And I know this is a very stressful time for you and your family because everybody wants you to be... That's okay, no worries. This is an accepting space. We want you to be the best you can be, me and your family included. So, but why did your family and parents specifically want you to go to those three chosen universities?
They don't believe I'll ever be successful if I don't graduate Ivy League and get a high-paying job.
Okay, so I agree. I mean, those are true statements. You're bound for success if you get into those things, but you can also be successful in many other places, in many other spaces. So I would personally suggest maybe community college to start, and then you can move up to a better, higher renowned education center.
Okay, thank you.
You're welcome. This is drug therapy session number 1. and we're going to talk about our problems, and I'm going to help you guys get through it. So my name is Leroy, and I would like to ask each of you about what your specific addictions are. Philip, what is yours?
Crystal meth.
Okay, so I have experienced many people with that addiction, and I am here to help you through it. We're going to get through it together, all right? What about Phil's addiction, and I need to know your specific addiction so I can help you get through it best.
I've been hooked on crack cocaine since I was 12.
Okay, so that's tough. However, we can help you get through this, and I've experienced many people with specific crack addictions that I can help you get through best. Months since our first meeting, and we've had a couple meetings in there which have shown good progress so far. So now 8 months out, 3/4 of a year, how are we doing? Philip, let's start with you.
I've been working this out with my family, following the treatment, and it's been about 2 months without the substance.
Well, that's very good, and we're all very proud of you. Jackson, what about you?
I had one relapse in a time in between our visits, but now I'm completely clean and completely sober, and it feels really good.
Well, that's very good. You know, group therapy like this, even with the small group therapy, it can really help because you guys have people that you can rely on and believe in yourself with. So good job.